So for those of you that don't know me, I'm Rachel Dunscombe, and that's my Twitter handle, UK Penguin. I'm the Director of Digital for Salford Royal, Northern Care Alliance Group. I'm also CEO of the NHS Digital Academy and work as part-time academic at Imperial College. And I'd like to tell you a little bit about our BI-Modal journey and what we have been doing and the kind of form that it's taken. So this is not necessarily all about openEHR and the work that we've done, but really it's around how we're incubating digital solutions to put around both the openEHR, our VNA, and also our corporate and our sort of back office systems as well. So obviously, I'm very fond of this slide, and I know that you've got Mike Jones and Thomas and other people talking today, but this is something that is becoming increasingly important for me, the BI-Modal approach. And the samurais and the ninjas are becoming more and more defined as in terms of roles. And so for me, I just wanted to talk a little bit about the kind of technology versus digital, because I'm seeing a really big split in the actual skills that are needed between these teams. So the samurai for us are the big corporate systems. They are about, you know, the historic sort of IT as it was. It's about traditional processes. It's about supporting traditional processes. And as it says here, the weapons are the standard tools, predictable, ultra-reliable, controlled, somewhat inflexible. And we had Bob Wachter, Dr. Bob Wachter, did a big review here in the UK where he talked about reimagining the work. The samurais are not about reimagining the work. They're really about, for me, the boxes and wires, but also the very traditional work that we've done in supporting people. But I think, in my mind, I've certainly aligned the ninjas on the other side with what Bob Wachter said. It's about reimagining what we do, and it is about creating ideas, experimenting. It's about creating business cases that are more systemic. It's about intelligent learning, and it's about open innovation as well. But it's fast evolving, unique, not as reliable. What I'd say is more prone to failure that we should accept and learn from. And low governance, I would say agile governance, and I think that's the world that we're in. So very much I now see my teams in these two boxes, but the ninjas are much, much closer to the business, to the front line, to the work that we're doing, and include in those teams the, you know, the clinicians, whereas the samurais are probably far more back office and are still needed, although I would say that, you know, the ones that are doing the traditional IT are going to become utilitized, and that will be put out to companies that you know, do utility IT. But the ninjas are where the real value is added for the future. So that's kind of my summation of you know, the BI-Modal approach. But before that, I'd like to talk a bit about industrialization, and I'm going to come into our geography in a minute and why that is important. So Industry 1.0 was about mechanization, steam and water power. It was, you know, the basics. Industry 2.0, mass production electricity. Industry 3.0, electronic and IT systems and automation. So that's probably where the samurais come in. And Industry 4.0 is cyber physical systems, and that's really where the ninjas come in. So I see BI-Modal really as a mix of the samurais being Industry 3.0 and the ninjas being Industry 4.0. So I'm going to have a quiz here, and there is a prize. I will send a prize to anyone. Does anyone here know who the man in the center of this photo is? Can you poll the room for me and see if anyone knows who the man in the center of this photo is? No? Does nobody know? Okay. So the man at the centre of this photo is somebody very local to Manchester, actually, and I'm just going to tell a little bit of his story. And I think you will finally know who he is when I tell you about him. So his name is Tony Wilson, and he's passed away. I was actually at his funeral a few years ago. But he was a man that was both a local broadcaster, a national broadcaster. He was somebody that spent a huge amount of time on economic development for the region here in the Northwest. He also, you know, created a lot of, you know, e-commerce and dot-com businesses in the north and got European funding for them. But he's probably better known as the manager of New Order, Happy Mondays, and a whole host of bands like Joy Division and so on that you will really know. He was the man behind Factory Records, the Hacienda. He created all of those, but he also had a little known history in economic development as well, and not much was written about that or talked about that, but he was very interested in industrial revolutions, and hence why he called his record label Factory Records, and he saw a huge parity between industrial revolutions and what was coming with the digital age. And before he passed away a number of years ago, he predicted what went from .com would then become the fourth industrial revolution. And what's really interesting for me was his ideas around factories and how you rapidly develop things, and also some of the frameworks he built for economic development for the region. He was a very, very interesting guy, and the work that he did really did, both in public and private sector, benefit this region. But he also did an awful lot of work around cancer. Both he and his partner had cancer, and he was a huge advocate of digitizing systems. And so he went from Factory Records, the Hacienda, right the way through to being very, very interested in healthcare. He had a first from Cambridge. He was an incredibly bright man. But actually, I think it was quite a lot of his narrative around factories and around production of new ways of doing things and new sort of revolutions or huge leaps forward in our thought process and the way we do things that captured me. So I don't have to give a prize out to anyone, that's good, but go look him up. He was a fascinating character, and I was very privileged to know him over about 12 years. But in honour of what he talked about, and in honour of the fact that we've actually got the fourth industrial revolution happening, we here at Salford have created a digital factory. And this is a picture of it here, and I'm going to talk a little bit about the digital factory. So the digital factory for us incubates solutions that sit around our clinical repository, our EPR, our productive systems. And for us, actually, mainly, they've not really been, plugged in to the clinical systems at this point, because the NHS is under huge amounts of pressure to save money. So my group, which is 1.5 billion turnover, has to find 100 million this year recurrent in terms of cost savings. So much of this initially has been built around cost savings, but some of it, like Helm and work we're doing around the patient record, is based around openEHR. So let me talk about some of the productive systems that we put in place here, and I'll talk about what's on the walls. So on the left here, you can see some robots, and those robots are actually reconditioned robots from Camp Bastion. They're actually military robots from the US, and the way that we are using them is to start bunkerizing services, and we're starting with care homes and also ICU as well. So what we're doing is we're getting our specialists together remotely off-site and then having on-hand service. And we are using the robots to ensure that we can optimize our clinical services. And that is really, really fascinating. So we've incubated that in our factory, and I'll come on to the methodology in a minute. But the aim of that is making our clinicians more productive and removing geography as a constraint. That's been a really, really fascinating project. There's been a huge amount of resistance from some clinicians to actually changing the way that we work, but it has been proven that it's safe to deliver many, many services remotely. And these robots, the entry price has gone up from hundreds of thousands, a few years ago, to £38,000 now for one of those reconditioned robots. And so the cost effectiveness is important there. But actually, those robots, instead of the openEHR, they plug into standard interfaces to some of our workflows, and so they create safety and quality benefits. And so they're really important for us, and that's been incubated in our factory. If we move around to the right, you'll see a drugs cabinet there, and also just to the very far right is a pill checker, and just off the photo actually is it's a deblisterer, so we can take drugs out of packs. And what we have here is a unit dose robot, which actually enables us to create bespoke unit dose boxes for patients that are biodegradable, which allow them to either, manage their own medications at home, or if we're using it for wards, it reduces us from needing a nurse to actually administer to an HCA or somebody else. And so that's completely changing our skill mix, in the acute and the community, and is also providing safety benefits for those people that need to have unit dose boxes at home, those people who have dementia or other, concerns that mean that they need that. And so we're actually starting to move that through. It's in our pharmacy as of next week to actually put that into wider operation. But again, that has been incubated with interfaces to our pharmacy and prescribing system as part of our methodology in order to get benefits for the wider system, both in terms of quality, and actually the wonderful thing with these systems is we will save between 7 and 20% of our generic drugs bill, because in deblistering and re-administering, we're saving on the packs that we give out because we give whole packs. And so there are some really great benefits there, both in terms of skill mix, but also in terms of drugs. Now, actually on those black screens that you can see there as well, which aren't on in this picture, that's where we are actually incubating some of our digital apps that are going to sit around our openEHR repository. And we're also starting to work on Helm, which is the patient record. And the aim there is that in conjunction with some other systems like healthy.io, which give home urine testing kits, which we have out with patients at the moment, we are starting to get our renal patients in the region more self-sufficient so that they don't have to come in for urine tests, so that they can have teleconsultations, and so that we can actually create a more remote service, but with the data flowing into open data and an open repository. All of these systems completely reimagine how we deliver work. They use digital to unconstrain the care we deliver. And openEHR is involved in, those ones in the middle, but because of the productivity gains needed in the NHS, the ones we've had to start on initially are the ones that have got the biggest cost savings around bunkerizing services and around the drugs and unit dose. But it gives you an idea of how we're starting to incubate the solutions that actually sit on top of openEHR and the systems we've got. So I'm just going to talk a little bit about the methodology that we've got. So that room that you see there is our experience centre, and that houses our digital factory, and we have a future digital pipeline. And the aim of that factory is to actually marry up our problem statements, which at this point are actually mainly financial for us, and our business need with solutions that we know are in the marketplace, but to as rapidly as possible close them down if they're not fit for purpose, or realign them with other use cases and problem statements if we're deploying them in the wrong place. So what actually happens here is we have a number of ways of horizon scanning. And what we do is we actually bring in things that we know are aligned with our business need and future sort of aspirations, and we put them on the future visualization wall, and they stay on there for probably 2-3 weeks. And every 2-3 weeks we have several hundred, 600-700 of our staff through that room. So they're constantly going through that room, and they're constantly giving us ideas of where that can be used. They're helping us tune, the alignment of where we will put it into a first area of deployment, and we get the outline business case from those interactions with the clinicians and the staff that we've got. So hands-on, we're getting hundreds of clinicians and back office staff with those technologies. What we then do is take it onto the next wall, the doing wall, and we put it into a lab pilot. So we have to build harnesses sometimes, and we've got openEHR in that harness at the moment for what we're doing with Helm. And that lab pilot allows us to prove the concept. We can get the plumbing in, that we can also do the governance and the IG. So we've got our governance guys down at this point who can conceptually put together how the governance will work. We then move it to the live pilot wall, and there we've actually got it out in a business area where it's being used, or out, in the homes of our patients and citizens where it's being used. And that's where we track through the success and project, the other areas that can be used. And we also build a full business case on that wall so that we have a full economic model for how it will benefit the organisation. And then Done Deployed Wall actually gives people a space to reflect on the lessons learnt and also look at any additional benefits that we can bring from technology. So this factory, we've initially got one here at Salford, but we've just commissioned 2 more in our other hospitals, because we have 5 hospitals. And so this is how we're actually incubating that new technology, including the sort of ecosystem that goes on top of the openEHR. So this is a really important photo. It looks like a load of people in suits. In fact, it looks like a load of grey people in suits. But the guy standing there looking, at a screen in the middle, is actually our health minister, Matt Hancock. And Matt Hancock is a very interesting character. So I spent a couple of hours with him last week, and I'm spending an hour with his lead advisor today. So he came in and he spent some time in the factory, and we went through all of this methodology and the systems we're using underneath, and how we are opening up both our back end productivity data and also moving towards the open standards and open platform. And that's very much his thing. He was the government minister for digital, so he's very pro digital, being open, and he's quite a savvy guy. You'll also see a lady near the door. That's Hadley. She's his chief advisor, and she is an open standards and open data guru. She advises on web standards and all sorts of things. She's on various committees internationally for internet and web standards, DNS, HTTP and other things. So she's a very bright and interesting lady. But he is pro openEHR, and I think this is a very good thing. I think it's very good that he gets the power and the opportunity of open data both for life sciences and for healthcare. And so here he was seeing one of our demos. We've got a camera crew there. He was being followed by several camera crews and journalists. But we definitely have had a sea change in the UK, and I'm very heartened to believe that he is willing to put back on the supply marketplace to make sure that open standards will become an absolute prerequisite. Otherwise, we will not do business with companies. And so it's an interesting journey. We're just starting with him and his advisors, but I do have some hope for the future. So here are some of the statements which I think are very interesting. So first of all, open data and technology are key to the transformation of government. So that was a statement he made before he joined health, but looking back at his track record, which I have done, he absolutely enforced open data standards across government. And so for me, again, that's a very good sign. A quote from when he joined us is, and feel free to use that actually, openEHR is the right answer. I think the more we spread that, the better. And he said that in front of several journalists, actually, who I don't think understood what he was saying, because to them, openEHR, it could be anything. But he said that publicly, and I think that was good, because he was challenging me on several things, and I gave an answer, and that was his response. So I think we have a health minister here who is very clearly tuned into what is needed. Another quote he's made recently is data platform and open APIs the future, and he's a man that very much understands platform. He very much understands that the power of the platform and that getting that right is important for the future. And he very much has, especially with Brexit, very sad about Brexit, but it appears to be a fait accompli now. We're not going to get away from it. He wants to develop the life sciences on an open data platform in the UK as being one of our main exports and offers globally. And so with the economic eye to this, he understands that the benefit of getting the platform right. So if you're not following him on Twitter, he's very prolific there. He's constantly tweeting, and I would certainly welcome you searching him out and encouraging him to take this journey with us and encouraging him to move forward with the openEHR landscape. So finally, I guess my reflections on this are, from what I'm seeing, things are moving forward. I think as a group of advocates for open data and open architecture, we are being listened to and we're getting leverage. and I think the future is very bright. So I think there's been an ecosystem around openEHR for many years, which has done some amazing work, and I think the time is now for that work. And I think it is the time where governments are becoming really, really interested in this. And, obviously we've got Thomas there who can talk about, Moscow and about, Brazil and other places. But I think we are getting leverage with further governments now who are traditionally the people that would have resisted this sort of thing. And I think they're seeing now that actually there is a clear link between this and economic viability and development, and that if industry and the GDP of each country is going to flourish on the back of healthcare data, it's going to need to be in an open format, and openEHR is the answer. So I think my final part is openEHR is the answer is a wonderful quote from the health minister, and I'm considering that we should echo that back to him on Twitter if possible, and congratulate him on being a visionary in terms of health ministers, and encourage other health ministers globally to actually take a look at the sort of policy that he is pursuing. So I think we have time now for questions. Is that right?
Yeah, I think so. Thank you very much, Rachel. We're using Slido for our questions today. The question is, what about security?
Yeah, so that's a really good answer, question, and there's a really good answer to that. So a couple of things. First of all, the minister talked about security, and abstraction by ambiguity is no answer to security at all. So I have heard people say that if we put things into bespoke systems, it's more secure, which I think is a ludicrous concept. So we here have got Cyber Essentials and Cyber Essentials Plus. We work with NCC Group, who secure our major high street banks, and they provide us with all of our cybersecurity planning and also all of the audits around our systems and security. So we do it to banking level standards because we believe that data is that important. And for all we have to cost cut here, one thing I will not cut on, and one thing I'm further investing in, is cybersecurity. So one thing, have the best on your side, and I believe we have, and certainly with the likes of WannaCry, that paid dividends, because I already had a pre-call off with NCC, who sent in all of their SWAT team to ensure that we could manage any issues we had. We didn't have any issues, but security has to be the first thing. The thing I like about the systems that we've got is that we are now getting to a position where we have an audit trail on the data that we use. And, I think a lot of the historic systems don't have audit trail. And one of the main things around security for me is knowing how the data has been used and who's used it. And it's been very interesting. We've had a celebrity here, a football manager, who you may well know of, who used to manage Manchester United. I won't mention him by name because I'm not meant to. But he's been an inpatient here after having a blood clot. And we were able to completely and transparently show all of the access to his data and justify why it had been used. And I think the really important thing for me is that we need to build in useful, accessible data, but bear in cybersecurity and audit control as part of that journey. But the fact that we shouldn't share data because we don't think that it'll be secure, I think that's an absolute non-argument. If you look into other industries that are sharing data, we can learn a lot from them. And certainly we've learned a lot from the likes of banking here at Salford.
Thank you very much, Rachel. We don't have any more questions on Slido. Are there any questions from directly from the audience? That doesn't seem to be the case. Okay, thank you very much for your brilliant talk, Rachel.
No problem.